infertility is a difficult and emotional journey that many couples endure for years. Arizona reproductive medicine specialists understand how overwhelming it is, and they are there to help. Joining me is Dr. Mark Johnson, along with his patients, Brandi and Jeff, and their little girl, Giuliana. Thank you so much for joining us. Little Giuliana is 5 weeks old. Congratulations. First of all, let me ask you two, what was this like? I mean, how long did you seek treatment before you were able to conceive Giuliana?
So Jeff and I actually tried on our own for about a year, and then went to infertility for about 3 years.
3 years. I mean, that's a long time. It's an emotional roller coaster, I can assume. What brought you to Dr. Johnson? What brought you to ARMS that you're like, we need this special help from them?
So we actually were referred by a friend, and actually a colleague of my husband's over at Valley Anesthesiology, and he basically just recommended Dr. Johnson in the group and said, you know, you might want to give him a try. And so we ended up over at their informational seminar and met Dr. Johnson and just thought, like, this is definitely a good fit for us.
And Jeff, you thought the same thing. I mean, this is, you know, to see your wife go through all these procedures. I mean, it's difficult, and you found this with Dr. Johnson, kind of the comfort that you two needed.
Right. My wife is intense, and it's very emotional, and I think Dr. Johnson and his team really took the time to understand her concerns and tailor how they manage the process to Brandi's needs.
And Dr. Johnson, their story, they're not alone in this. You see a lot of patients looking for help.
Yeah, about 10 to 15% of couples in reproductive age will suffer from infertility, and it's a disease that's fairly common.
What procedure did you undergo, and tell me about your experience?
I actually did 3 inseminations prior to coming to Dr. Johnson, and then just kind of felt hopeless and ended up switching over to Dr. Johnson's office and tried 3 inseminations, 2 with IVF drugs, none of which, you know, were successful. So then we moved to IVF. You know, you definitely feel hopeless, but with a great team and a great doctor, it's, you know, gives you that hope.
And is that a lot of it, is feeling that team feeling when you go into an office, that you know that the entire staff is with you and behind you? Is that kind of what you pride yourself on?
That's how our practice is basically put together, as a family building families. I mean, all 3 doctors have gone through infertility ourselves in some fashion, in some form, in order to build our families. And we have teams of medical assistants, nurses, financial counselors to help people along their journey. So all of us work as a team in order to come up with this wonderful outcome.
And it has to be so amazing. I mean, obviously being when you found out you were pregnant, first of all, I mean, tell me what that emotion was like.
It's so amazing and so surreal. I feel like you just can't believe that it's actually happened.
Of course, then you start thinking that you could have 3 little babies, and you keep looking in the back of your car, imagining 3 car seats.
You're like,
amazing.
But yeah, you're like 1, 3, we're blessed. And how great is it for you as a doctor to see patients like this come through on the other side and just have a little miracle in their arms?
This is what brings me to work every day, to be honest with you. This is wonderful. It's beyond belief, you know.
And what do you want to tell patients when they come and see you? Like, what do they need to keep in mind during this journey?
That most couples, most patients, when they come to us, will come out happy. It may not be with the type of treatments that they're thinking, but most will come out with their family that they've wanted to build for so many years.
And stay positive. And believe in your doctor.
Persist.
Yeah, I would just say that the goal is to, when they give you statistics like 6 and 10, focus on the 6, but understand that there's a chance, a 4 in 10 chance, that it might not work out. And then don't be disappointed if you only have 5 eggs or 2 embryos. Focus in that it only takes 1, and I think, you know, it works out.
You only need 1 egg for a miracle and have a little beautiful, healthy baby girl. Congratulations so much. Doctor, thank you so much. It's just so neat. And I can tell from you and just in your eyes that it's just every little baby is...
It's wonderful.
It brings so much joy. So thank you. Oh, everyone needs a good stretch in the morning. Thank you so much, and congratulations again.
Thank you.
And of course, for more information about ARMS, Arizona Reproductive Medicine Specialists, just visit them online at arizonafertility.com or call the number on your screen.